Imagine seeing a majestic deer. Seems perfectly healthy one day, and then the next. Well, it's behaving in ways that are just deeply unsettling, maybe even bizarre.
Yeah, or think about a llama, usually so calm, suddenly showing these really worrying neurological signs.
Exactly. It's strange to think about what could possibly link these really different animals, right?
Hmm.
And what we're digging into today is this fascinating, almost kind of mysterious condition. It really shows how something that seems minor, like a small injury, can spiral into really severe, often life-threatening brain problems. Welcome to the Deep Dive. Today we're plunging into cranial abscess syndrome, CAS for short.
And we're looking at it in two very different groups of ungulates, hoofed mammals, specifically cervids, that's your deer and moose and camelids, so llamas and alpacas.
And our sources, they make it really clear that while the end result, this brain abscess, is disturbingly similar.
Yeah, the way they get there is fundamentally different between the two groups.
Which gives us some pretty unique insights into animal biology, behavior, and health. So our mission today, we've got this stack of scientific articles, comparative reviews, some really great source material.
Definitely.
And we're going to pull out the most important bits, the key knowledge, maybe some surprising facts about how this condition shows up, how it's diagnosed, and how it's managed, or sometimes how it can't be managed in these two families.
We're aiming to give you that shortcut, basically, to understanding this complex issue, hopefully with a few aha moments along the way.
All right, we've set the scene with these pretty dramatic examples. But let's back up a bit. Before we get into the deer versus the llamas, what exactly is a brain abscess?
Right. So basically, a brain abscess is a pocket of pus that forms right inside the brain tissue.
Okay.
It's a localized collection of what we call purulent material that's just pus, and it starts with an infection.
So bacteria get in somehow.
Exactly. It usually starts as a localized inflammation, something called cerebritis. Then that area progresses to, well, tissue death, necrosis, and liquefaction. It sort of turns to liquid. Yeah. And then the body tries its best to wall it off, forming this fibrous capsule around the whole mess.
But that walling off doesn't really fix the problem, I imagine.
Not in the brain, no. Because it's still a space-occupying lesion, right? It takes up space where it shouldn't be.
Ah, right. Inside the skull.
Exactly. So that leads to increased pressure inside the skull, which can cause secondary brain injury. The brain tissue gets squeezed, potentially herniating, pushing through openings where it shouldn't.
Which leads to those neurological signs we mentioned.
Precisely. Severe neurological deficits, and often, sadly, it's fatal.
Is there one particular culprit, like a specific bacteria we should know about?
There is one major player, especially in hoofed animals, Trupperella pyogenes. It's a gram-positive bacterium. And what's interesting is that it's actually a commensal organism. It lives normally on the skin and mucous membranes of many animals, particularly ruminants. It doesn't usually cause problems.
So it's just there.
Yeah, it's part of the normal flora. But if there's tissue injury or if the animal's immune system is weakened for some reason, it becomes opportunistic.
It sees its chance.
It does.
Right.
And it can cause all sorts of nasty suppurative infections, pus-forming infections, including these brain abscesses. It's just waiting for that opening.
Okay, so an opportunistic infection leading to this horrible abscess.
Mm-hmm.
You'd think maybe it would affect different animals in roughly the same way.
You might think so, but that's where our sources really highlight a crucial distinction. For deer and camelids, endpoint the abscess is similar, but how they get there? Well, it's fundamentally different.
And this is where it gets really interesting, understanding those different paths.
It really is. We're not just looking at, slight variations on a theme. It's more like two distinct disease processes or paradigms that just happen to end up with the same awful result, an abscess in the brain.
Okay, so what's the core difference in a nutshell?
In deer, what we call cranial abscess syndrome, or CAS, is a very specific thing. It almost exclusively hits adult males, and it's directly, intimately linked to their antlers. But in camelids, the llamas and alpacas' intracranial abscesses are much more varied. They can affect any age, any sex, and critically, they're usually secondary complications. They happen because of some other infection that's already going on somewhere else.
Secondary, that's a huge difference. Let's dive into the deer first then. That antler connection seems so central. What is it about the antlers, or maybe deer behavior, that makes them so vulnerable?
You're right on track. CAS in deer is uniquely tied up with the whole biology of the male deer, specifically that antler cycle. And Trupperella pyogenes is the main bad actor here, exploiting breaks in the skin on the head.
So how does it get in? How does the antler cycle create those breaks?
There are basically three main routes, all connected to antlers and related behaviors. First, you've got damage to the velvet antler.
The fuzzy stuff when they're growing.
Exactly. In spring and summer, antlers are covered in this velvet. It's skin, really, full of blood vessels and nerves, very sensitive. If that gets injured, bacteria can easily get in.
Makes sense. What's next?
Second is trauma during the rut, the breeding season in autumn. Bucks fight, they spar aggressively.
Headbutting, locking antlers.
Right, and that often causes injuries not just to the hardened antlers themselves, but also to the pedicles, those bony stumps they grow from, and even the frontal bone of the skull. These can be deep wounds, perfect entry points for bacteria.
Okay. Velvet injury, fighting injury. What's the third way?
A third one is antler casting or shedding. After the rut, they naturally drop their antlers.
Right, they fall off.
And that leaves a raw, open wound on the pedicle. It's basically an open door for bacteria from the environment until a scab forms.
Ah. So even if they don't fight hard, just the normal shedding process creates a risk.
Exactly. It's a predictable, non-combative way infection can start. And this probably explains why we see CAS more often in older bucks. They've simply gone through more cycles of growing, fighting, and shedding, more chances for infection over the years.
So the bacteria gets in through one of these routes.
Yeah.
Then what happens? How does it get inside the skull?
Well, T. pyogenes sets up shop in that initial wound, forming a localized abscess on the head, maybe near the pedicle, but it doesn't stop there. The infection often progresses deeper, leading to osteomyelitis.
Bone infection.
Yes, infection of the underlying skull bones. From there, the bacteria can actually penetrate the skull itself, often finding weaker points like the suture lines where the skull bones meet.
Wow.
And once inside the cranial vault, it forms one or sometimes multiple intracranial abscesses. And those are the space-occupying lesions we talked about, compressing the brain, causing inflammation, and leading to those neurological problems.
It sounds relentless.
Yeah.
So we know it hits older bucks more often. What does this mean for the deer population overall? Is it a major threat?
It's well documented, especially in white-tailed deer, but seen in moose too. And yeah, the epidemiology is stark. Adult antlered males are disproportionately affected. That's all tied back to the antlers and rutting. And prevalence does increase with age, more rutting seasons, more shedding cycles.
Is there a particular time of year it's worse?
Definitely. There's clear seasonality. Most cases pop up between October and April.
Which covers?
Exactly. It covers the rut when those sparring injuries happen, and then the winter and early spring period when they shed their antlers. Geographically, it seems widespread across their range in North America.
So it hits mature bucks during and after the breeding season. Does it actually limit the population, though?
It's generally not considered a major population limiting factor across the entire species range. However, locally, it can be a significant cause of death for mature bucks. Some studies found it accounted for maybe 9 or 10% of mortality in that specific group.
That's not insignificant for the older males.
No, it isn't. It can definitely influence local herd demographics, things like the age structure, the ratio of bucks to does.
It really makes you think. The very things, the antlers, the fighting, that make a buck successful in reproducing
are the exact same things that open the door for this potentially fatal disease. It's a stark example of an evolutionary trade-off, isn't it?
Absolutely. A powerful, almost cruel irony. So when this infection really takes hold in the brain, what are the signs people might actually see in a deer?
Well, initially it might be subtle. Maybe just some open sores, some weeping fluid, or obvious pus near the antler base, or even around the eyes.
Okay, external signs first.
Right. But as it progresses into the brain, the signs become much more dramatic and neurological. We're talking loss of coordination ataxia, circling behavior, apparent blindness, weakness, severe weight loss, or emaciation.
And behavioral changes, too.
Profound behavioral changes, yes, like a complete lack of fear of humans, which is very abnormal for a wild deer, or sometimes uncharacteristic aggression.
That sounds disturbing to witness.
It is. And sometimes the bacteria can even get into the bloodstream septicemia, which might cause other signs like swollen joints. It's a really nasty, aggressive infection once it establishes.
You mentioned before that some of these neurological signs, the wasting, the odd behavior, sound a lot like chronic wasting disease, CWD.
They do, and that's a huge diagnostic challenge in the field.
So how critical is it for wildlife managers or even hunters to tell them apart? And are there any clues besides maybe seeing pus?
It's incredibly important to differentiate. CWD is another fatal neurological disease, a prion disease, and managing it requires different strategies. The symptoms overlap significantly: the wasting, the stumbling, the strange behavior. It makes telling them apart just by looking at the animal very, very difficult.
So what's the key differentiator, if there is one?
Really, the most suggestive sign for CAS in the field is seeing that visible, purulent discharge the pus or obvious trauma around the head, especially near the anther pedicles. If you see that along with the neurological signs, CAS becomes a much stronger suspect than CWD.
But a definitive diagnosis.
Almost always requires a post-mortem examination, a necropsy, for free-ranging deer.
Oh.
The pathologist would find those pus-filled abscesses in the brain, often with signs of bone infection in the skull nearby, and then bacterial culture confirms Trupperella pyogenes.
And treatment for wild deer, you said.
Yeah, unfortunately, treatment just isn't considered feasible. By the time those neurological signs are obvious, the infection is far too advanced, and it's essentially always fatal.
And you can't really prevent it either.
Not practically. The bacteria is everywhere. It's part of their normal makeup, and the ways they get infected are tied to absolutely essential parts of their life cycle: growing antlers, competing for mates, shedding antlers. You can't stop that.
What about public health? If a hunter harvests a deer, is there a risk? You mentioned T. pyogenes is zoonotic.
It is technically zoonotic, meaning it can spread to humans, but it's very, very rare. The main practical concern for hunters is really about the general health of the animal. If a deer has obvious abscesses, especially on the head, there's a potential for bacteria to have spread systemically, causing septicemia or blood poisoning.
So the recommendation is?
The strong recommendation is, do not consume the meat from any deer showing visible abscesses, particularly around the head. Better safe than sorry.
Right. A grim picture for the deer, really, tied to their very maleness in a way. But now, let's pivot completely. Camelids, llamas, alpacas. You said it's a very different story there. How so?
It really is a whole different ballgame. In camelids, intracranial abscesses aren't this distinct syndrome like CAS in deer. They're almost always a secondary problem.
Meaning they stem from something else going wrong first.
Exactly. They're a severe complication of some other primary infection happening elsewhere in the body. And the cause isn't just T. pyogenes either, although it's definitely still a player.
What else do you see?
You see more variety. Bacteria like E. coli, fusiform species are common, especially in newborns, Crius, and often it's polymicrobial, multiple types of bacteria working together.
Okay, different bacteria, and it's secondary. So how do the infections actually get to the brain in llamas and alpacas? What are the routes?
They're fundamentally different from the trauma route in deer. There are three main mechanisms we see. First, especially in Crius, is hematogenous spread through the blood.
How does that happen in newborns?
It often ties back to failure of passive transfer, or FPT. If a cria doesn't get enough colostrum, that first milk packed with mom's antibodies right after birth.
Their immune system is weak.
Exactly. They're highly susceptible to systemic bacterial infections, what we call septicemia. Bacteria get into the bloodstream, circulate around the body, and they can cross the blood-brain barrier and seed the brain, starting these abscesses.
So finding an abscess in a cria is like a red flag for a bigger problem.
Absolutely. If you connect that to the bigger picture, an abscess in a cria strongly suggests a failure of passive transfer, and that might point to a potential herd-wide issue with colostrum management. It's a really important signal.
Wow. Okay, so that's one route in crias. What are the others?
The second major route is autogenic extension, basically spread from the ear.
Ear infections.
Chronic middle and inner ear infections, yeah. They can be a really significant cause of brain abscesses in both juveniles and adults. If an ear infection smolders for a long time, it can actually erode through the bones of the skull base.
Right into the brain cavity.
Directly into the adjacent brainstem or cerebellum. And a key point here is the notoriously stoic nature of camelids.
They don't show pain easily.
Not at all. They can hide signs of illness, including ear infections, until things are really quite severe. So you need a high index of suspicion. You really have to be looking closely for subtle signs.
Okay, blood spread in crias, ear infections. What's the third?
Dental abscesses. Chronic tooth root infections.
Like in humans.
Similar idea. A bad tooth root abscess can become a source of bacteria that spreads either through the bloodstream hematogenously or sometimes by direct extension if the abscess is high up in the jaw.
So in camelids, finding a brain abscess really means you have to start digging for an underlying cause somewhere else. FPT, ears, teeth.
Precisely. It's often a sentinel event, a serious warning sign that there's a more significant, maybe chronic health problem in that animal, or potentially reflecting a broader issue within the herd.
That completely changes the approach, doesn't it? For a vet, it's not just treat the abscess, it's find the source. What kind of signs are they actually looking for in the camelid itself?
Well, the clinical signs are really variable. It completely depends on where the abscess is in the brain, how big it is, whether there's more than one.
Makes sense.
So you can see a whole range of neurological problems. Incoordination, ataxia, a head tilt, circling, seizures even. Cranial nerve deficits are common too, things like facial paralysis, maybe difficulty swallowing, or just general depression and lethargy.
Quite a range. How do vets narrow it down?
A really thorough neurological exam is absolutely crucial. You need to systematically assess everything: the mental state, behavior, cranial nerve function, how they walk, their posture, reflexes. That helps localize the problem within the central nervous system.
And again, remembering they might be hiding things.
Always. With camelids, that stoic nature means you have to maintain a high index of suspicion. Assume there might be something serious even if the signs seem mild initially.
Okay, so unlike the situation with wild deer, where it's basically untreatable, there seems to be more potential for diagnosis and maybe even treatment in camelids.
Yes, definitely. Antemortem diagnosis before death is absolutely feasible in camelids, and that opens the door for potential intervention.
What are the key diagnostic tools then?
One important tool is analyzing the cerebrospinal fluid, the CSF.
The fluid around the brain and spinal cord.
Exactly. It's usually collected from the lumbosacral space down near the tail base. In cases of bacterial brain abscess, the CSF often shows telltale signs of infection and inflammation. Typically, an increased number of white blood cells, especially neutrophils, those are the primary infection fighters, and also elevated protein levels. These point strongly toward an infection within the central nervous system.
Is it foolproof?
Not entirely. It's important to know that a normal CSF result doesn't completely rule out an abscess, especially if it's really well encapsulated, walled off, and not directly communicating with the space where the CSF circulates.
Okay, so CSF analysis is helpful, but not definitive. What else?
This is where advanced imaging becomes really powerful. It's often the definitive method.
Like x-rays.
Radiography or x-rays can be useful, yeah, especially for spotting those potential primary causes like severe dental disease or maybe bone destruction around the ear if you suspect otitis.
But for seeing the abscess itself.
For that, CT computed tomography and especially MRI magnetic resonance imaging are the gold standard.
What's the difference in what they show?
Well, CT is fantastic for looking at bony structures, so it's great for evaluating those ear infections, skull issues, maybe trauma, but MRI gives you superior soft tissue contrast.
So better for looking at the brain itself.
Much better. MRI lets you precisely locate the abscess or abscesses, see the capsule, get an idea of the contents, and visualize all the surrounding inflammation or secondary effects like brain swelling or herniation.
Are there typical signs on an MRI?
Yes, there are characteristic findings. Often you'll see these masses that might look sort of iso-intense on certain sequences, maybe with concentric rings of different signal intensity on others, and typically they show peripheral contrast enhancement. The capsule lights up after giving contrast dye.
Okay, so advanced imaging can really pinpoint the problem, which leads to the big question. If you can diagnose it, can you treat it? Is there actually hope for these animals?
Yes, there is. Treatment is feasible, and it can be successful. The key, though, is early diagnosis and really aggressive intervention.
What does treatment involve? Primarily antibiotics?
That's the foundation, yes. Long-term, broad-spectrum antibiotic therapy. Ideally, you'd get a sample of the pus, maybe through aspiration, and culture it to see exactly which bacteria are involved and which antibiotics they're sensitive to.
But you might have to start before you get results back.
Often, yes. So you start empirically with antibiotics that are known to cross the blood-brain barrier effectively and cover the likely suspects drugs like high-dose penicillin, maybe third-generation cephalosporins, flurfenicol, or metronidazole for certain types of bacteria.
And you said long-term.
Very long-term. We're talking 4 to 6 weeks minimum, sometimes even longer, depending on the response.
Is surgery ever an option?
It is, absolutely. Surgery is a viable option, especially if the abscess is large, if it seems well encapsulated and maybe less likely to respond to antibiotics alone, if it's in an accessible location, or if the animal isn't improving with medical therapy.
What kind of surgery?
It can range from procedures like stereotactic needle aspiration, using imaging guidance to place a needle and drain the pus, all the way to a full surgical excision of the abscess and its capsule through a craniotomy.
Opening the skull.
Opening the skull, yes. It sounds drastic, but there are actually documented cases, particularly in juvenile alpacas, where complete surgical removal led to successful outcomes.
That's amazing. So what's the overall prognosis then? Is it generally good, bad, somewhere in between?
Overall, the prognosis is generally considered guarded to poor. It really depends on the specific situation.
Factors like.
Well, for crias that develop abscesses because of septicemia, the prognosis is usually poor because they're dealing with a systemic infection too. If the case is diagnosed very late, like an adult with a huge abscess from chronic otitis that's caused major brain damage, the prognosis is often grave.
But with early action.
But it is significantly improved by that early diagnosis and aggressive treatment. And in those cases where surgical removal is possible and successful, the outcome can actually be good. Some animals can return to pretty much normal function. So there is hope, but prompt action is critical.
Okay, so let's tie this all together now. We've heard these two really distinct stories about cranial abscesses in deer versus camelids. What's the big takeaway message here? Why do these differences matter so much?
I think the biggest takeaway is that even though the end result looks similar, that devastating abscess inside the brain, the journey there is fundamentally different.
Right.
In deer, CAS is a primary disease, deeply woven into the fabric of male biology, their antlers, their behavior. It's almost a direct consequence of being an adult male deer.
Whereas in camelids.
In camelids, it's almost always a secondary complication. It's a signpost pointing towards some other underlying health issue, failure of passive transfer, a chronic ear infection, a dental problem.
And understanding that difference has real-world implications for how we manage these animals.
Yeah, right. Absolutely. If we connect this to the bigger picture, for wildlife biologists studying deer, understanding CAS is vital. It helps them interpret mortality patterns, especially in mature bucks, and it's crucial for accurate disease surveillance, particularly telling it apart from CWD.
And for vets dealing with llamas and alpacas.
For large animal veterinarians, finding a brain abscess in a camelid should set off alarm bells. It means you need to look beyond the brain and investigate potential systemic or herd-level problems. Is there an issue with colostrum management for the crias? Are chronic ear infections going unnoticed in the herd? It requires a broader diagnostic approach.
So this deep dive really hammers home that distinction. Cranial abscess syndrome in deer, a primary tragic consequence tied to their life cycle. Intracranial abscesses in camelids, a critical warning sign of other underlying health battles.
Exactly. Two paths, same unfortunate endpoint, but vastly different implications.
It leaves you with some things to really think about, doesn't it? Like how that intense evolutionary drive for reproduction in male deer literally creates the pathway for a fatal disease. That trade-off is just striking.
It really is.
And then on the other side, how the quiet, stoic nature of animals like llamas and alpacas demands so much more from us, more vigilance, a deeper understanding to uncover the health problems they might be hiding.
Yeah, it highlights the importance of really knowing the species you're working with.
Absolutely. It just shows the kind of profound insights we can gain into animal biology, into disease processes, into veterinary care, just by taking the time to do a deep dive into a specific condition like this one. Makes you wonder what other surprising connections between behavior, physiology, and health are still out there, just waiting for us to uncover them.